A nurse is assessing a patient who is post-operative from abdominal surgery. The patient reports pain level of 8/10. Is breathing rapidly. The patient is breathing rapidly and has a blood pressure of 88/50, right? Which of the following is the nurse priority action? 1. Administer pain medication as prescribed. 2. Take the patient's temperature. 3. Assess for signs of shock and notify the healthcare provider. And number 4, assist the patient in deep breathing exercise. What is your answer? Right answer is C, which is assess the patient for signs of shock and report to the healthcare provider. It's already giving you hints, right? They are breathing rapidly. They have blood pressure of 80. That's blood pressure is low. And remember, guys, when I tell you that when the blood pressure is low and the heart rate is high or they are breathing rapidly, assess for signs of shock. Do not play with assess for signs of shock. This is giving you signs of shock, and specifically hypovolemic shock. Why? Because they had surgery. It might have been as a result of loss of blood, right? And that is why the answer is C. A nurse is providing discharge instruction to a patient with diabetes who has been prescribed insulin. Which of the following statements made by the patient indicates a need for further teaching? Listen, need for further teaching. Number 1, I will check my blood pressure levels before meals and at bedtime. I will rotate my injection sites to avoid tissue damage. If I miss a dose of insulin, I will take a double dose the next time. I will store my insulin in the refrigerator to keep it stable. What is your answer? The right answer here, if your patient says, if I miss a dose of insulin, I will take double dose the next time. Please, you have to teach them not to. You teach them to take their insulin as soon as they remember. If they miss the insulin, they should take it as soon as they remember. But there is a clause, there is a but. If when they remember, it's close to the time they will take the next dose, they missed one, they forgot to take it, and it's almost time to take another one, and that's when they remember that, oh, I didn't take the previous one. They shouldn't take it because that's going to be double dose, and it can cause hypoglycemia, low blood sugar. It can reduce their blood sugar. So you have to encourage them. Whenever they remember, if it's still far apart to when they'll take the next one, they can take it. But if it's very close, no, they should just wait and take the next scheduled dose. Okay? A nurse is caring for a client who is receiving warfarin therapy. Which laboratory test is most important to monitor in these patients? Warfarin therapy. Warfarin is anticoagulants. Warfarin therapy. A, platelet count. 2, B, hemoglobin level. C, prothrombin time, PT. And D, white blood cell count. What is your answer? I know some of you might be confused when you don't see INR because that's for warfarin too. But prothrombin time is also coagulating time, right? INR or PT is what you will monitor for warfarin, okay? A nurse is caring for a 65-year-old patient with osteoarthritis who is prescribed acetaminophen for pain relief. The nurse should advise the patient to avoid taking what? Number 1, milk. Number 2, alcohol. Number 3, vitamin C. And number 4, calcium supplements. What is your answer? The right answer is alcohol. I believe everybody will get this. Alcohol. Guess what? Even if you do not know what osteoarthritis is, but look at the list of what they mentioned: milk, alcohol, vitamin C, and calcium supplements. Even if you don't know, you know when you're taking medication, you shouldn't take alcohol. Boom, bingo. Reason why they will tell you not to take acetaminophen with alcohol because alcohol combined with acetaminophen can cause liver toxicity. It can cause liver damage in simple terms. That's why they'll tell you not to take it. A patient who has been on long-term steroid therapy, right, presents with moon face, buffalo hump, and weight gain. What condition should the nurse suspect? First one, Addison disease. Second one, Cushing syndrome. Third one, hypothyroidism. And fourth one, hyperthyroidism. I believe this is plain and simple. And the right answer is Cushing syndrome. After taking steroid therapy for a long time, it causes you to gain weight, and it can cause fat redistribution to your face. That's why you have the swollen face, which is the moon face, round face, buffalo hump. In fact, it causes you to have hirsutism, like a lot of hair in your body, you know. And the right answer is Cushing. All right, guys, thank you.